My name is Peter Ranspach, and I'll be discussing a case of persistent phantasmia following the resolution of COVID-19 illness in a 59-year-old male. Phantasmia is the experience of smelling an odor that is not actually present in one's environment. It has been seen in migraines, where it's considered a type of aura, as well as temporal lobe seizures, brain tumors, and upper respiratory infections, although it is quite rare in all of these. How often does phantasmia occur in COVID-19 illness? Well, a recent multi-center European study of COVID-19 patients found that 86% of patients in their population had some sort of change of smell during their course of COVID-19 illness. Of those, 13% had phantasmia. So how long does it take for these patients to recover their sense of smell? Well, about three-quarters of patients who had recovered their sense of smell at the time of this analysis had experienced this resolution within 8 days of the resolution of their COVID-19 illness. However, there are many cases of such recovery taking much longer. So how do we treat phantasmia? Well, most often we don't, and it's just treated conservatively and allowed to recover on its own. However, many medications have been used, including antipsychotics, anti-migraines, and anti-seizure medications. Venlafaxine is used relatively commonly. However, it's not particularly effective. Transcranial stimulation and topical cocaine application are very rarely used. The most effective treatment really seems to be olfactory mucosa excision, although this is quite invasive. It will remove the patient's sense of smell for the rest of their lives. A 2008 systemic review showed that 10 out of the 11 patients that had this procedure performed in their analysis had at least short-term relief of their phantasmia following this procedure. Notably, the olfactory mucosa pathology received back after these procedures often show an increased incidence of neuromas, as well as a higher concentration of immature neurons when compared to normal olfactory mucosa histology. So what are these patients smelling exactly? Well, a 1985 to 1995 study performed at the Taste and Smell Center in Washington, D.C., found that many patients smell something cosmic or fecal-like, or something rotten, about 34 out of their around 150 patients. Also, a chemical-like smell was quite common, and in third place was a burned, smoky smell. Although, of course, there was a wide array of smells noted during the study, including medical smells or even a sweaty smell. So let's move on to the clinical course of our patient. Day 1, he experienced fever, shortness of breath, a dry cough, body aches, fatigue, and malaise. And of course, he tests positive for COVID-19 that same day. We move forward 17 days to day 18, and all these prior symptoms have now resolved, but he's developed new symptoms, which he describes as a sinus headache, mild congestion with minimal clear discharge through the nares, and the constant smell of burning cigarettes. He says it is not painful or causing him to vomit. It waxes and wanes in intensity throughout the day. It never remits, except when he's sleeping, and it never changes in character. He waits 60 days to come to clinic, and so he presents to us for the first time on day 78. His symptoms remained unchanged from day 18. His past medical history is shared at this time. He has coronary artery disease, hypertension, and obstructive sleep apnea. The surgical history is limited to a repair of a septal perforation over 20 years prior. On physical exam, the sinuses are non-tender, and when looking through the nares, we see irritated, friable mucosa in both the nares. So our plan was to give him oxymetazoline, really just for the congestion and drainage. We ordered a non-contrast brain MRI since he had a headache, and there have been recent cases of olfactory bulb lesions, as well as intracranial necrosis, seen in patients with anosmia following COVID-19 illness. So we were essentially trying to rule out any sort of brain lesion that has been noted in patients similar to him. However, his MRI was ultimately negative. As of now, he's still being treated conservatively with observation. He consulted an ENT who agreed with our plan. My references may be seen in the bottom right, and I thank you for your time.